Welcome to another episode of Talking with Docs. I'm Dr. Brad Wiening.
And I'm Dr. Paul Zalzal.
Today's episode, we're going to be talking about what to expect before your hip replacement.
Yeah, that's a common question we get. People say, what do I have to do before the surgery?
So we're going to go through a list of things, and hopefully this allows you to feel a little bit more prepared for a big procedure and hopefully a big change in your life.
Okay, so you've left your doctor's office, you've booked total hip replacement, you've got some information with you. The information tells you that you're going to be needing to make an appointment at the hospital for a pre-operative assessment.
So usually what I tell my patients, Paul, is that they're going to have to see a couple people beforehand from a medical perspective. So they'll have to see their family doctor, typically to fill out what we call here a history and physical sheet. And then they'll have to be seen in the preoperative clinic, and that's to do things like blood work, an x-ray, potentially an electrocardiogram, and maybe see the anesthetist depending on the type of other medical problems that they have.
Right, so first thing you're going to do then is you've got some tests that have to be arranged. And see some physicians before. And why do we do all this stuff before? That is to minimize the chance of a complication. Please refer to our total hip video for a listing of the things that can go wrong. But those are very rare, and the way we make these complications rare is by doing this preoperative workup beforehand.
The next thing I like to do, Paul, is I like to talk about people about physically what do they need to do before the surgery. Do you give them any specific guidelines or recommendations?
Yeah, there are some things. If they have a modifiable risk factor, so that's a risk factor is something that puts you at risk for a bad outcome. And if it's modifiable, it means we can change it before. So that would be things like smoking and obesity. I would counsel someone to try and quit smoking and try and lose weight if possible before their surgery.
Good suggestions. I think the other thing is for maybe if you had a diabetic patient, try to keep their sugars under good control, make them less sweet.
Yeah, that's a good way to look at it. So yeah, that's modifiable. If you can get your blood sugars under control, for sure. So we try and modify risk factors.
All right. What about physio? What about prehab?
That's a good one too. So physiotherapy before a hip replacement can be helpful. Possibly you can try and increase some of the range of motion if your hip is very stiff. That's difficult to do. Physiotherapy can contribute to general conditioning. Sometimes I tell people it's like training, for a marathon. If you can get yourself in as good shape as possible before the surgery from a musculoskeletal and cardiovascular point of view, that's going to help your outcome.
I think that's a great idea. And the thing that I tell them too is that if you know the exercises before when you don't have as much pain, sometimes it prepares you for what to expect. So then a physiotherapist comes in, they're not trying to teach you all these new things and you're stressed about your pain and you just had surgery, so it allows you to focus a little bit better.
Okay, good. So we've set you up now. You've got preoperative appointments with some doctors. You've got some blood tests. You're going to modify some risk factors. And you may do some prehab physiotherapy. What else?
I like to have people to have a formal plan of what they're going to do when they leave the hospital.
Okay.
As part of their preoperative plan. I want them to have a postoperative plan. So where they're going to stay, essentially.
Yeah, I should do that. I don't know if I do that. That's a good point, because then you're not stuck with it at the end after the surgery's done. You're like, okay, what do I do now? Come up with a plan for after, so that you know where you're going to go, who's going to help you out, because you may need some help, and you can refer to our video on after your hip replacement, what to expect. But that's a good idea to do that beforehand. Specifically
before, so say you are going home, I like to give people a little bit of a guideline as far as maybe things that they would want to do in their house, and this is also part of our hospital's preoperative course that they teach. Things like whether or not you need a special bed. What do you tell people as far as beds?
No, I think if you have a normal bed at home, if you sleep in a normal bed, you should be okay.
Like a water bed?
I don't know. I haven't had that situation since the 70s.
Okay.
But no, definitely, a fairly firm mattress. What about getting into bed if it's upstairs?
So I tell people you're going to be able to go up and down the stairs before you leave the hospital. If you have to go up a lot of stairs, you may have to do it slowly. And it may be easier to bring a bed down onto the main level, but it's not mandatory.
Yeah. Generally, before you leave the hospital, the physiotherapist will teach you how to go up and down stairs.
And then other little things for the house, potentially a raised toilet seat or a commode, possibly like a little grabber, things to grab things off the ground because you're not going to be able to bend as much once you have your hip replaced, and then a walker and or a cane, obviously.
Yeah, okay. So get all this stuff in place in the house beforehand.
Yep.
All right. Anything else you got to prepare for?
I tell people that I don't want them to shave their operative site. Some hospitals have specific preps where you can clean the operative site, so do whatever your hospital asks you to do. Just don't shave it for the skin.
And the reason for that is, I guess there were some studies that showed there may be an increased bacterial count around the skin if you do some shaving before, and also if you cut yourself or something like that, that might even cancel your surgery.
Which would be unfortunate.
Yeah, yeah.
And I guess lastly, what about eating and drinking? As you maybe even the night before, you going out having a couple of drinks?
Yeah. Go party. No, probably. Yeah. The general rule is NPO, which means nothing by mouth, at midnight. So you can eat and drink up until midnight the night before your surgery, then nothing to eat or drink. And why is that?
The main reason, because people are like, that's crazy, I have to wait so long and I'm hungry and I'm thirsty. The main reason is if you have stuff in your stomach, like liquid or particularly food, it increases your chance of throwing up when you receive an anesthetic. And if you throw up, that's a small problem, but if you throw up and then breathe it back in, that becomes a potentially life-threatening problem.
Yeah, that can
It's called aspiration or aspiration pneumonia.
Yeah, so that is dangerous. So you really want to keep an empty stomach when you go in for hip replacement. So let's say some people are on a lot of medications. What kind of medications do you have to stop before surgery? What kind of medications can you keep taking?
So I do not specifically tell people what they can and can't take. That should specifically be addressed in the preoperative clinic. So a lot of times you're allowed to take your pills with small sips of water. Let your family doctor or the anesthetist make that guideline. I think the one specific thing is anticoagulation, which is becoming progressively more and more common. That needs to be under the guidance of a physician, depending on why you take anticoagulation, but typically it does have to be stopped. And potentially you might have to stop your pills and maybe even take a needle for a short period of time in order to bridge you over to surgery. Right. So follow the guidelines of your physician.
Yeah, so you'll get a lot of that information on medications when you go to your pre-op visit at the hospital. And that's pretty well covers all the stuff you have to prepare for. What kind of things might end up happening that I might have to cancel my hip replacement?
So I'm sure they're limitless, but yeah, one would be a issue local to your hip. So if you had an infection in the area of your hip, if you actively had a blood clot, that would be a reason. If you got severely sick for some reason.
Yeah, what about a bad cold?
So again, that's a bit of a dealer's choice depending on the severity. So usually I tell people, obviously show up for your procedure. If you're getting a cold close to the surgery, call your surgeon and let them decide whether or not they need to reassess you, cancel you, or just proceed.
Right. And ultimately that decision is made in conjunction with you and the surgeon and the anesthetist who has to anesthetize you. And upper respiratory tract infection or other illnesses can make that more challenging and complicated.
So hopefully these tips allow you to feel a little bit more prepared for your upcoming procedure.
And it's okay to be nervous. You probably will be. Everybody is. But just remember, it's a very common procedure. Many, many, many hip replacements occur every day. And the vast majority of the time, everything goes very well, and the outcomes are excellent in the majority of cases.
Well said.
Thanks. Just thought of that.
Yeah, there you go.
Well, thanks for watching.
And please, if you have any further questions on this topic or any other topics, feel free to email us at talkingwithdocs@gmail.com.
And remember, you are in charge of your own health.
See you next time.